here. What are the pros and cons of carrying out abdominoplasty and epigastric hernia repair at the same time? Epigastric hernia repair. I don't. Who said anything about doing an epigastric hernia? So if you've got a small, usually periumbilical hernia, it will be repaired at the same time as an abdominoplasty because the overriding operation is the abdominoplasty and the hernia is just incidental. If you've got an epigastric hernia, I think probably that should be looked at. Certainly, an opinion should be made about whether that needs to be repaired, whether that's causing problems, or whether that needs to be paid separately to an abdominoplasty. You can do abdominoplasty and hernia repair at the same time, and the pro would obviously be that it's one operation rather than two. But the con is that if you have wound healing problems, if you have any issues with infection or anything, that can be bad with an abdominoplasty. And certainly if you're doing an abdominoplasty, your risks of wound healing problem and infection are significantly more than if you were just doing a hernia repair on its own. So if you did get a wound healing problem, if you did get an infection, particularly if a mesh is used for the hernia repair, if that mesh becomes exposed or infected, it would have to be removed, which can be an absolute nightmare. So it's not something that is commonly done, hernia repair and abdominoplasty. And usually if it was done, it's usually people who are often not very well. They've got a huge abdominal apron and they're just trying to do it for comfort rather than doing a formal cosmetic abdominoplasty. It's not a common combination. So usually I would say, let's, obviously good to have a discussion if you're going to have an abdominoplasty in the future, but I would have a discussion regarding the hernia repair, what needs to be done, and perhaps this discussion between the plastic surgeon and the general surgeon prior to doing the hernia repair, just to ensure that maximizing your ability to have an abdominoplasty in terms of the skin scarring that you get from the hernia repair.